by Dr. Anand. This is the Unacademy NEET PG platform, and today we're gonna talk about very important cardiology. We are coming to the ending of the cardio series. We had a very wonderful time with all our lovely students on the journey of cardiology, and and we have covered amazing lot of questions on cardiology. We have covered all the amazing the topics related to cardiology. So for the newcomers, this is the Unacademy NEET PG platform. My name is Dr. Anand, and don't mind about my cough because my COVID is almost getting out. That's why. So, my name is Dr. Anand, and first of all, very important for everyone, for our amazing newcomers, we have this very amazing, mind-blowing NEET PG quiz contest, which is basically of 60 questions, 60 minutes, and for 45 questions, which is on Jan 23rd. Jan 23rd, 11 a.m. is our what you called. There is a PG contest, basically NEET PG quiz contest. What do you get? Nothing. Nothing you'll get. You'll only get 10 lakh rupees. Do you want 10 lakh? I want 10 lakh rupees. So you get 10 lakh rupees of worth of rewards, a lot of amazing vouchers, a lot of amazing things you get in Unacademy, and also a very wonderful congratulations to our amazing FMG toppers who have worked really hard, and they are there on this amazing top rank list. And now we have Rashi, Vaidahi, Priya, Savan, Osama, and Husna, all amazing people who are working very hard. Your names will be there, and on one day your name definitely will be there on this platform. And also, guys, we have a free test calendar for the medical PG prep. I hope you guys are really participating. If you're a newcomer, we have amazing mind-blowing MCQs discussion and MCQs free test, which you must do. Okay. In the Unacademy, we have something known as Plus subscription and something known as Iconic subscription. In the Plus subscription, you get to study from the best of the best educators all over the India. Also, at the same time, you get to access all my classes. You can watch me on your iOS, on your laptop, and you get to participate in various tests and quizzes. The test and quiz is everything, okay? So you must attend. And this was the Plus subscription. Hi, Rachna. And now in the Iconic subscription, you get the Unacademy platform, and also you get the Prep Ladder subscription. All the clinical notes, video lectures, question bank, rapid revision, treasure notes, everything you get on the Iconic subscription. Okay. Okay, remember, and also we have made this Focus FMG 2022 batch and a Target NEET PG 2022 batch also, which is going amazing. The January has started, guys. Only February is left, and now March we have our exam, and I want you all to do the best of the best. So I told you this is the Plus subscription, and we have the Iconic subscription. And most importantly, being an MBBS student, sometimes if you think the pack is little expensive, then you use this code. It will be little financially comfortable for you if you use this beautiful, mind-blowing, handsome code. The code is Dr. Anand. Okay. And also again, rank 1, rank 2, rank 3, whosoever will participate in all these tests, basically the rank 1 is getting 1 year old, 1 year plus subscription free. Then rank 2 will get 6 months plus subscription and 3000 rupees Amazon vouchers, and rank 3 will get 3 months of plus subscription. So it's good, right? You work hard and you get it. No, you work hard and you get it. It's as simple as that. All you have to do is use a code, and for this code is Dr. Anand is the code. Just use the code and enjoy life. That's all. It's as simple as that. And I hope you guys are doing our day after tomorrow, like after 2 days, we have Dr. Mona Lisa on the anatomy. She's having this study with me test on Unacademy app. If you are free, guys, please attend it. It will be nice. And that's it. Okay, so आज करते हैं आज शाम की शुरुआत. I hope you guys are full charged up, and I want you to put your best of the best vibration in this class. Today I'm gonna talk about, most importantly, number one, I'll take some test. First of all, I'll take a 20 MCQs rapid test of yours. Okay. Number two, and if time permits, we'll start our very important discussion on the rheumatic fever. Today's topic of choice will be rheumatic fever. Okay. So yes, let's start. And before starting any mind-blowing, handsome segment, we always have this mind-blowing quote. And today's quote is beautiful quote. Today's quote is stay focused. Stay focused. Time is less. Time is less. January has started. February is left. March is the exam. We all are working really hard in our life. Just stay focused. Stay calm. Stay composed, control your heart rate, control yourself, control your mind, think before you speak, think before taking an answer, think before doing argument with someone. Just think and stay focused. Stay focused, stay focused. Very important. Okay, it's a very beautiful quote. Stay focused. Okay, it's a very, very, very good quote. Okay, so let's start the MCQs round. The MCQs round, we are at the question number 84. Okay, so I'll repeat again. So the question we're gonna start now. So question number 84, whiteout lung. Whiteout lung is seen in which condition? The options are hyaline membrane disease, obstructive TAPVC, pulmonary alveolar proteinosis, surfactant protein B deficiency, massive pleural effusion, and all of the above. क्या जवाब देंगे इसका? Okay, we have amazing people who are answering. Yes, Pancake has come. Hello, Pancake. What's up? Hello, Rachna is right. Priya is right. Yes. The best answer to this question is nothing but whiteout lung is seen in various conditions. These are the five important conditions: hyaline membrane disease, infracardiac TAPVC, which is nothing but obstructive TAPVC, pulmonary alveolar proteinosis, surfactant protein B deficiency, massive pleural effusion, and all of the above. Okay, that you should know. Very good. Question number 85. Downward displacement of tricuspid wall is seen in which congenital heart? Question number 85. Who will tell me? Yes. Staphylococcus says, Good evening, sir. चमक रहे हो. कहाँ चमक रहा हूँ? Pancake ने बोला है कि shave नहीं करनी, and I'm not done shave, and I'm feeling so angry. I want to shave, but she's like, no, you will not shave. Should I shave? Yes or no? What do you think? I badly want to shave, but should I shave or should I just keep some beard? What do you think, guys? Yes or no? Should I shave? Yes or no? And just now I'm recovering from COVID. I'm looking more thin. My mom is like, you're becoming more thin day by day. So no. Seriously, dude. Seriously. Seriously, dude. You think though I shouldn't shave? Okay, thank God. Rachna says I should save. So sweet of you, Rachna. God bless you. God bless you. Okay. Anyone who think I should save? Rashi. Okay. Rashi is nice. See, I have good friends. Rashi says yes. Rachna says yes. बाकी जिससे पूछ लो सब मना कर रहा है. Okay. चलो ठीक है. Let's continue. Okay. Rachna gives a heart. The pancake. Everyone is not saying no. Two people said yes also, dude. Who? Everyone is not saying no. Question number 85. Yes, Savan has given the best answer. Downward displacement of the tricuspid wall. Downward displacement of the tricuspid wall. We all know that it is seen in Epstein anomaly. And what is the ECG finding of Epstein anomaly? We all know that ECG finding of Epstein anomaly is Himalayan P waves. Himalayan P waves. Yes or no? Very good. Very good. Yes. Majority says no. Yes. Okay, fine. I will not shave. I'll just get some cut done, some cut over here, and I'll make a beard or something. If you have any good ideas of keeping up like some beard styles, you send me on IG. Okay. Question 86. I am a newborn 2 days old. I am a newborn 2 days old. During my routine examination, doctor found my femoral pulses feeble and bounding upper limb pulses with high blood pressure in my upper limbs. So, what is my beautiful diagnosis? So, what is my beautiful diagnosis? Yes. So, this my grandmother also can answer. This is nothing but coarctation of aorta. This is our very importantly aorta. If this is the coarctation, if this is the blockage here, then more and more pulses, like more and more blood will be there accumulated in the upper limbs, and less blood will go in the lower limb. So bounding upper limb pulses, peripheral or feeble lower limb pulses. These were the two important points, and also change in the blood pressure of upper and lower limbs. Yes, that was also one point. And very importantly, this one, figure of three appearance. Figure of three appearance you will see in nothing but in coarctation of aorta. Right? Very good. Question number 87. Himalayan P waves. Himalayan P waves in ECG is seen in, I think everyone knows about it. Himalayan P waves in ECG is seen in Epstein anomaly. And anywhere else, anyone other than Epstein anomaly, do we see Himalayan P waves anywhere else? We have done in this class also. Tricuspid atresia. Even in some cases of tricuspid atresia, we see Himalayan P waves. Yes, very true, very true, right. Question number 88. All congenital cyanotic heart disease causes right axis deviation except dash which causes left axis deviation. Who will answer this question? What do you think? All congenital cyanotic heart disease causes right axis deviation except one. Which is that one congenital heart which causes left atrial enlargement? Anyone? Okay. Pancake says VHD. Wrong. Pancake, VHD is not a cyanotic congenital heart. It is a acyanotic congenital heart. Okay. TOF, no, TOF is not the right answer. In TOF, you see right ventricular hypertrophy, right axis deviation. You don't see left axis deviation or LVH in a case of tetralogy of Fallot. VSD, no, VSD is a acyanotic congenital heart. I'm asking all cyanotic congenital heart disease causes right axis deviation. So the answer to this question is nothing but tricuspid atresia. Tricuspid atresia. Tricuspid atresia basically causes left axis deviation. Remember, this is our four-chambered heart and this is our tricuspid wall. And if there's a little atresia here, then I told you tricuspid wall is always associated with some other defect. So the blood which was there in right atrium directly goes to the left atrium with the help of foramen ovale, and more blood will go to the left ventricle. So basically in tricuspid atresia you will see left atrial or left ventricular hypertrophy, nothing but left axis deviation. Yes or no? So yes. So this is one case. Okay, so all the congenital cyanotic heart disease causes right axis deviation except tricuspid atresia, which causes left axis deviation. Okay. Huh. Okay, yes, exactly. If it was just a congenital heart, if I would say a congenital heart disease, which congenital heart will cause left axis deviation, then yes, BSD causes left axis deviation, whereas ASD doesn't cause left atrial enlargement. That's very important. In ASD, in atrial septal defect, you do not see atrial enlargement, right? Whereas in VSD, you see left atrial as well as left ventricular enlargement also. Okay. Sorry, don't mind for my cough. Question number 89. I am a 4 year old girl. I am a 4 year old girl. I have a past history of corrected COA. I am a 4 year old girl and I have a past history of corrected coarctation of aorta. Today I delivered multiple episodes of fever. Today I delivered. Why am getting cough? Let me have a Wix. In the meantime, please read question number 89. Please read question number 89 and tell me the best diagnosis. In the meantime, I will take a Wix goli. Wix ki goli lo, kich kich dur karo. Yeah, I'm doing gargle also, dude. Yeah. So what do you think? Question number 89. What is the best answer to this question? Fine for your friends. Hmm. I'm a 4 year old girl. I have a past history of corrected coarctation of aorta. Today I developed multiple episodes of fever with splinter hemorrhages. Where do you see splinter hemorrhages? Anyone? Splinter hemorrhages on my nails. What is the best management in my case? The options are surgical closure again, naloxone, indomethacin, or antibiotic therapy. Okay. Anyone? So what do you think? Yes. So what do you think? So surgical closure is a better answer or antibiotic therapy is a better answer? Where do you see exactly? So very good. Husna is very right. Husna Shireen. So in splinter hemorrhages, you will see in infective endocarditis, right? Hemorrhages, right? Very true. The question number 89, the best answer will be antibiotic therapy. You don't do the surgical closure again. The best answer in a case of infective endocarditis, the best management you do is antibiotic, because splinter hemorrhages the baby is developing. So splinter hemorrhages is seen in infective endocarditis, and the best management for this question is antibiotic therapy. Question number 19. The condition which is not compatible with life unless there is another cardiac defect like ASD, BSD, or PDA to allow the mixing of blood between the two parallel circuit. Which condition are we talking about? So what do you think? Anyone? Which condition are we talking about where you have a parallel circuit and you need some other defect for the survival of the baby? Exactly. Dr. Savan Singh, yesterday Savan had come to my house for dinner. Thank you, Savan. My mom, dad, they really loved it. Thank you. Thank you so much. God bless you. Hmm. Which flavor Vicks pancake? You are very funny. And this is menthol. Menthol. Menthol is good. Exactly. The best answer to this question is TGA. What is TGA? Transposition of great arteries. In our previous classes, we have already covered. In a case of transposition of great arteries, there is parallel circulation. And to make the life compatible with that parallel circulation, you need some defect, some another defect to be there with the TGA. The answer is transposition of great arteries. Question number 91. Identify the position and in which condition do we see. What is this position and where do you see? The option is knee chest position in tetralogy of Fallot, elbow chest position in tetralogy of Fallot, none of the above, or A plus B. Yes, very true. This we have. That's very true. People who are giving right answers are very importantly Pancake, Vaidahi, Priya, Osama, Tanu, Staphylococcus. Very good, very good. People who are answering have 100% chances they will clear this exam by any means. So yes, the answer is knee chest position. Can anyone tell me why knee chest position is beneficial? What is the highlighter? What are the two important points I should remember for the case of knee chest position? Why knee chest position is helpful in a case of tetralogy of Fallot? Exactly. But why? Why it is helpful? Number one, knee chest position decrease the venous return to the heart. Yes or no? Do we remember this? Knee chest position decrease the venous return to the heart. That is the first point. And also it increase the systemic vascular resistance. It also increases the systemic vascular resistance. So right to left shunt will not be there. Infundibular spasm will not happen. That's it. Exactly. Yes. Very good. Very good. Yes. Very good, Savan. Very good, Pancake. Perfect. Question number 92. 7-month period of gestation, preterm, newborn, delivered today. 7-month period of gestation. Which is the most common congenital heart disease come to your mind? Anyone? 7 मंथ का बेबी डिलीवर हुआ है, कौन सी कंजेनाइटल हार्ट डिजीज आप एक्सपेक्ट कर रहे हैं? एनीवन? वेरी गुड. एग्जैक्टली. सावन. 7 month. 7 month. 7-month old baby, the most common congenital heart in a preterm child, Savan, will be a patent ductus arteriosus. Yes or no? PDA is my best choice. If I say a term baby having cyanosis and which cyanotic congenital heart you will expect, the answer will be TGA. Otherwise, the answer is PDA. Yes, exactly. Pancake is right. PDA as the baby is preterm. Question number 93. True or false? 7-month period of gestation, preterm newborn, mother noticed bluish discoloration of nails and oral cavity at day 1 of life. Can we think of patent ductus arteriosus? So can we think, is it true? Can we think of patent ductus arteriosus or is it false? No, we can't think of patent ductus arteriosus. What is the best answer? Exactly. Doctor and caffeine is right. Why it is false? Hmm. Why everyone's saying true but only one student said false? अच्छा जी, पैनकेक अच्छा सोच सकते हैं, मैं तो सोचूंगा. क्यों? Why? 7 month का बेबी है. He's a preterm baby. If mother note, we can think of PDA, right? Mother noticed bluish discoloration of nails and oral cavity. Is this statement true? Exactly. Very good. This statement is false. It's a big false statement. We will not think of PDA in this case. Why? Because PDA is the acyanotic congenital heart disease, and mother noticed bluish discoloration of the nails and oral cavity at day 1 of life. PDA is the acyanotic congenital heart, not a cyanotic one. Even though I agree the baby is a pretermer, the baby is having cyanosis, and PDA is the acyanotic congenital heart. The statement is false. Hmm? Hmm. एक्रोसाइनोसिस हो सकता है, हाँ कुछ और भी हो सकता है, कहने की बात है. पीडीए नहीं होगा. मतलब मेरा सवाल है, पीडीए हो सकता है सर? पीडीए ए साइनोटिक कंजेनिटल हार्ट होता है, रफली मेरे हिसाब से नहीं होना चाहिए. ओके, क्वेश्चन नंबर 94. Term 1 day old newborn. A term baby, 1 day old newborn. Mother noticed bluish discoloration of nails and oral cavity at first day of life, which is the most common single possible diagnosis. What will you answer? Very good. Nishi Agarwal has the best answer. A term baby having cyanosis, or cyanotic congenital heart, the at day one of life, the best answer is transposition of great arteries. Very good. Question number 95. True or false? Babies with obstructive or infracardiac TAPVC should undergo immediate surgical correction. Is this line true or is this line false? Yes, pancake, definitely it can be acrocyanosis. But now it's like a level 2 of thinking. Simple question I'm asking: preterm baby with cyanosis. Can you think of PDA? My question, this topic is cardiology. Cardiology. You need to think in cardiology, way of thinking. Right? Hanji. Yes, exactly. Staphylococcus is right. Priya, Husna, Osama, Staphylococcus, Nishi, Savan, Vaidahi, and Basant is very true. Infracardiac TAPVC needs urgent surgical correction. So this line is true. Question number 96. How do you distinguish acrocyanosis from cyanosis of a congenital heart? Very good question. It's a very good question. Yes. So what do you think, guys? A, B, C, D. What do you think? How do you differentiate acrocyanosis from a cyanosis of a congenital heart? In acrocyanosis, acro means periphery, and it's only the palm and soles, not the lips or the nails, or like nails are there, but only the palms and the soles, not the oral cavity or the lips or the nose. Hmm. Okay, very good. How do you distinguish acrocyanosis from cyanosis of a congenital heart? Acrocyanosis will not present throughout the day, and acrocyanosis will have peripheral cyanosis. This is the best line. This is the best line. Acrocyanosis doesn't present throughout the day, dear. It is present only for some amount of time, and after some time acrocyanosis goes off. That you should know, because SpO2 of a newborn at first minute of life is 60 to 65%, but by 10th minute of life it becomes 85 to 95%. Yes or no? So after 10 minute of life, after 85 to 95%, the acrocyanosis should go. Yes or no? Very good. So number one, acrocyanosis will not present throughout the day. Acrocyanosis will have peripheral cyanosis. Acro means periphery, cyanosis means blue discoloration. Option B, acrocyanosis will present throughout the day. No, that's a wrong line. Acrocyanosis will only have central cyanosis. No, it will have peripheral cyanosis. So it's a false, 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 and option number A is our best answer. Question number 97. Large left to right shunt leads to repeated respiratory tract infections. Is this line true or is this line false? What do you think? Very good. Staphylococcus. Thank you, dear. Acrocyanosis. Acro means periphery. Acrocyanosis means periphery, bluish discoloration. And acrophobia is nothing but fear of height. And we have germophobia is fear of germs. Very, very good, very good. हाँ जी. कोई false बोले तो बताओ. हाँ, exactly. Please remember my dear friends, whenever there is a left to right shunt, could be a ASD, could be a VSD, could be a PDA. So in a case of ASD, VSD or PDA, which is a left to right shunt, the more the blood will go into the pulmonary artery, there will be increased pulmonary blood flow, and means when more and more blood goes to the lungs, the more infections can happen, the more respiratory tract infections, more URTI, more LRTI. That is always you should know. So left to right shunts can lead to repeated respiratory tract infection. That you should. Okay. Yeah. So you had the second. Okay. Okay, for dinner. So it's a good question. Savan and basically what we had. Savan had come to my house. Our class got finished at 9:40 p.m. Then Savan came at 9:50 p.m. to my house. My mom, dad, my bhabhi, my doggy, everyone was there. My niece. We had jeera aloo. Then we have what do you call dal makhni, and then we have what do you call shalgam. I think बहुत कम लोग खाते होंगे शलगम. हम शलगम खाते हैं. And then we have what you called, of course, we have roti. Then also we had raita, and then we had three types of sweets we had, and then we have pickle. Then I showed him my house. Then we went out with my doggy Oscar, and we had a very good, nice 30 to 45 minutes of walking outside our colony, and nicely we came. And then I showed him my tortoise also. My brother has a tortoise also. Very nice. I'll show you someday. But any one of you, please, most welcome to my house, and I'll show you my tortoise also. It was very nice. It's a Sawan is already answering. Aloo, shalgam, dal makhni, roti, raita, good. Here. शलगम शलगम की इंग्लिश नहीं पता मेरे को. क्या होती है सावन शलगम की इंग्लिश जरा गूगल करके बताना. फॉर स्वीट्स वी हैड सावन कौन से स्वीट खाए थे हमने. एक तो हमारे पास देखो आई डोंट नो इंग्लिश में स्वीट्स को मतलब आई डोंट नो द नेम ऑफ द स्वीट्स इन इंग्लिश. हमने गुड़ खाया. देन एक तिल के लड्डू आते हैं तिल के लड्डू. हमने वो वाले खाए. और एक और भी थी पिन्नी जैसा कुछ था पिन्नी जैसा. तो हमने इसमें से गुड़ खाया था. वेरी गुड. ओके. Question. Very true. Okay. अच्छा शलगम को टर्निप कहते हैं. ओके. पिन्नी 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 तो बहुत अच्छी चीज होती है. सावन क्या होता है पिन्नी क्या होती है ब्रो. जैगरी इज गुड. पिन्नी पिन्नी मम्मी बनाते हैं. आई डोंट नो व्हाट्स द नेम. व्हाई एम कफिंग सो. ओके. Question number 98. I am a 1 year old with a congenital heart disease. I am a 1 year old with congenital heart disease. 4 months 4 months back, I had several episodes of respiratory tract infection. Now my episodes of RTI have gradually reduced and I'm feeling good. So what is my next best step? Now please read this question number 98. It's a very interesting question. It was a super specialty cardiology question came to my SS exams. So what will you answer? Question number 98, please have a look and let me know. So what do you think? What is the best answer for question number 98? पूरा दिन खांसी नहीं होती जितनी मर्जी बातें करा लो. क्लास शुरू होती दुनिया की सारी खांसी इसी 30 मिनट्स में होनी है. बट इट्स ओके. नीड टू लर्न हाउ टू लिव. लेट्स सी. Mm-hmm. Okay. Let's see who has the best answer. Who will tell me? Okay. Okay. So it's a very interesting question. It's a cardiology question, guys. Let's see if you can answer this question, then you can cover anything. Okay. Hanji. So I'm a 1-year-old child, okay, with congenital heart. I was having I was having repeated respiratory tract infection. I was having a repeated respiratory tract infection. That means what? That means I was having some more to left to right shunt. Yes or no? I was having repeated respiratory tract infection means I was having more left to right shunt. Yes or no? Now my respiratory tract have now my episodes of respiratory tract infection have gradually reduced and I'm feeling good. What is my next best case? The patients of Eisen mingerization. The patients of Eisen mingerization or the patients of reversal of shunt. The patients of Eisen mingerization or the patients of reversal of shunt will show you these typical features of increased respiratory tract infections, and then there a phase will come then that the respiratory tract infection will reduce. What does this mean? This means that my pulmonary hypertension have started to develop because my left to right shunt will come down and my cyanosis will be more. This is the answer. And also at the same time, I may be inoperable. Option number E is the best answer to this question. The meaningful line is that I was having a left to right shunt leading to increased respiratory tract infections. Now I have developed pulmonary atresia or pulmonary stenosis or pulmonary artery hypertension. So that increased URTI, LRTI have stopped and for some time. And this typically happens at 1 year of life. This typically happens at 1 year of life that baby feels better. Mother is very happy that the child is feeling better now. Is the URTI, LRTI have reduced. But the reality is the child is inoperable. The reality is the child has gone to Eisen mingerization or reversal of shunt. So it's a very important question. And yes, the answer to this question is question number 98. The answer is option number E. Okay, very good. Question number 99. Any cyanotic congenital heart disease child having ongoing fever from a very long time. Congenital cyanotic heart disease child with fever for a long time. You must suspect what? Infective endocarditis, brain abscess, both, or none of the above. What do you think? Hmm. Very good. Yes, the right answers are given by our dear Anand, Vaidehi Sawan, Dr. Nishi Raghuvansh. कितने सारे लोग आंसर करते हैं लिटरली. Priya, Staphylococcus, Husna, Vaidehi, and Dr. and Caffeine. Yes, any cyanotic congenital heart patient with fever, you must think, of course, of infective endocarditis and also of brain abscess. You should think of both. You should think of both in these conditions. Question number 100, the last question. Question 100 hai kya? True or false? Okay. If the child is having cyanosis with failure, features of failure, that periorbital swelling, facial puffiness, raised JVP, and all that, from day of life 1, TOF physiology is usually ruled out. Is this line true or is this line false? Brain abscess, same, because when there is lot of respiratory tract infections, no, the blood become little viscous because of the compensatory increased hemoglobin production, and whenever there is a hyperviscosity, the blood clots get formed, and though that is the reason for infective endocarditis, and that clot only can go to the brain, and that clot is like a nidus for the infection, like the stasis of secretion and stasis of blood is there, right? There's a clot that's a nidus for the infection, leading to brain abscess. Okay, question number 100. If the child is having cyanosis with failure from day of life 1, tetralogy of physiology, top physiologists usually ruled out. Is this line true or is this line false? Exactly. This line is very true. Tetralogy of fellow patients do not present at birth. They are symptoms of failure. Yesterday we were talking about, right? Test spells, exertion, suck rest suck cycle, palpitations, tachypnea, tachycardia, all those failure features are not present at birth. It takes time for the top patient to show the features, and of course one more very line we told, that top patient can rarely go into congestive cardiac failure. They rarely go into congestive cardiac failure because the VSD component, the ventricle septal defect component, is so large, and so large the VSD is there, that whatever blood is there in the right ventricle, it directly goes off into the left ventricle. There is no, shunting or no murmur kind of a thing there. It's like a large VSD, so they rarely go into failure. Exactly. So Priya is right. Very good. So that finishes one part. Let's do the second part of the questions. Like now we're gonna do the uh, very important topic. The topic of the choice will be only do for 5 to 10 minutes. The topic of the choice will be very important. Acute rheumatic fever. Very important. Rheumatic fever. Before starting again this quote, this segment, we have this quote again shared by our dear Dr. Savan. You have to die a few times before you can really live. You have to die a few times before you really live. Lot of times, in life, we get so much of struggle, get so much of hardships, get so much of heartbreaks. We almost die mentally, physically, spiritually, emotionally, and we rise again. This is life. You know, for understanding the real meaning of life, for understanding the real maturity of life, you need to be kicked out by people, and then you will realize the real phase of life. For all of the stories, that good times and bad times and good times and bad times will come. It is the bad times will teach you that how good the good times are, and that will give you another meaning of life. So you have to die a few times before you can really live. Today's topic of choice will be very important, nothing but rheumatic fever. Rheumatic fever is a very important choice. Exactly. He loves alcohol. Okay, this fellow. Okay. Yes, so many messages in my inbox. Yes, my inbox is usually full. Rheumatic fever. So, rheumatic, again, guys, remember, stay focused. Okay. Just 5 minutes. Even we'll talk just for 5 minutes, and then we'll wind up this topic. 8:30, we'll have a class again today. Then we're going to talk properly about acute rheumatic fever. As acute rheumatic fever is a big topic in a way. We have like John's criteria, major, minor, clinical feature, treatment, what is major, what is minor. So beautiful topic. It's a very important 10 marks question for a medicine student, and also for a pediatric student. Rheumatic fever. Okay, anyone, let's just talk about it. Rheumatic fever, guys. Like, how much do we remember? How will the patient present? A case of rheumatic fever. How will the patient present? What do you think, anyone? Will the patient come to you with fever? How the patient will present to you? What do you think? Hmm. Exactly. Osama Sheikh is very right. Osama usually don't participate in the messages comment. He only answers to the point, and he keeps studying. He answered to the point and he keeps studying. And whereas people like Pancake, Savan, and the Staphylococcus jumping here, there, here, where, here, like that. Okay, good. Exactly. Anand is right. A patient, for example, on a patient on 1st of March came to you with cough and cold. A patient on 1st March came to you with cough and cold. You thought it is a lower respiratory tract infection, and you gave amoxicillin. You gave a antibiotic. Thank you, doctor. You're such a nice doctor. अब बहुत आराम आ गया. I'm feeling so good, doctor. Thank you so much. So nice of you, doctor. On 15th March, that patient comes to you again. This time, the patient which came, he came with a murmur. You ausculted the chest. There was a big murmur on 15th of March. A patient who was all perfectly all right on 1st March and was only having cough and cold. Now coming on 15th March with a murmur. Why, anyone? What is the problem? Why? That's how the patient comes to us. डॉक्टर साहब गांव में दिखा रहे थे, खांसी जुकाम था, कोई दवाई ले ली थी, पिछले महीने दिखाए थे गांव में, यहाँ पे आए तो मरमर निकल आया. तो वाई एनी वन, वाई सच अ चेंज? इज दिस नॉर्मल? what is the what is the one line, one word will you tell me which explains everything? Have you heard of antigenic mimicry? Yes or no? Have you heard of antigenic mimicry? This is what happens exactly. This is antigenic mimicry. Whenever I get cough and cold, I have antigen in my body. Yes or no? Antigen has entered in my body. That because of cough and cold, the bacteria, the antigen has entered in my body, and my body will make antibodies against it. Yes or no? If I'm having exactly right. So if I am having cough and cold, my antigen will, the foreign organism or antigens will enter in my body, and my body will make antibodies against it, right? Now, the face of the antigen of the which is the main problem here. Have you heard of GABA? What is GABA? Have you heard of group A beta hemolytic streptococci? Group A beta hemolytic streptococci? Yes or no? So the GABA basically, who is the main culprit over here. So what happens? There is an antigenic mimicry. My antibodies are killing the antigen. At the same time, the face of the antigen is almost the same, the face of my heart. Whatever those antigens are there is a mimicry. The antigen basically looks like my heart. So I kill the antigen, of course, but also my antibodies are killing the heart. That is known as antigenic mimicry. That's how smart, that's how so smart the bacteria is. The antigen is becoming a shape of the heart itself, so that my antibodies can't recognize which one is the heart and which one is the real antigen. So my body is killing the both. So that is known as antigenic mimicry, which is so important in a case of acute rheumatic fever, right? Like I'm explaining in a very very simple manner. I'm explaining to a 7th class student. इससे simple नहीं आता मेरे को, किसी और को आता तो मुझे बता देना. So this is the first thing we need to understand. Rheumatic fever is an immunological disorder. It is a immunological disorder. Number one, it is caused by GABA. GABA is group A beta hemolytic streptococci, right? We'll learn this topic in a very simple, very simple, form, beautiful format, right? Number one, it is an immunological disorder caused by GABA. GABA is group A beta hemolytic streptococci. What is the main pathology? The main pathology is antigenic mimicry. See, these words are very important. These words only will give you marks for exams. So number one, GABA is important. Number two, it's an immunological disorder, and basically antigenic mimicry is what is happening. Yes. PG entrance question number 4. What is the most common age group for rheumatic fever? Will a 50-year-old patient can present with rheumatic fever? Or I would say, kind of a, what you called, a 10-year-old baby will have rheumatic fever. What do you think, guys? Very good. Who is right? Yes, Rachna is right. Nishi is right. Savan is right. Yes, M1 protein bacterial surface resembles. Tanu is like full with a nice sophisticated manner. The M1 protein in bacterial surface resembles tropomycin in endocardium in valves. नहीं, मैंने सुना ही नहीं। ठीक है, आगे बढ़ते हैं। तो द मोस्ट कॉमन एज ग्रुप इज नथिंग बट 5 to 15 years. द मोस्ट कॉमन एज ग्रुप, वेरी इंपॉर्टेंट एग्जाम क्वेश्चन, is nothing but 5 to 15 years of age. Next question. Yes, it is rare in less than what and after what? Less than how many years you will say that it is very rare? The answer is, of course, 3 and 30. 3 and 30. Acute rheumatic fever. Pancake says, Sir, my internet got disconnected, so I missed. Pancake, you already know this topic. You already know. तो हो जाएगा। कुछ नहीं समझ में आए तो मुझे बताना, ठीक है? Yes, acute rheumatic fever is rare in less than 3 years old and in rare after 30 years of old. How will you remember? 330, that's it. Okay. Next. Yes, very good question. Male is to female ratio. Is acute rheumatic fever is common in savan or is it common in pancake? Anyone? Savan or pancake? Savan. Tell me what is this? Anji. It's common in what? Is it common in savan or is it common in pancake? What do you think? Savan, what do you think? Pancake? Anji. Okay, Staphylococcus says more in male. Savan says savan. Nishi says pancake. Okay, many people are saying savan. Let's see. It is equally affected. It is equally affected. Okay, it is equally affected. Usually, book says that mitral valve disease and chorea are more common in pancake. Again, remember, I think we are beautifully learning it. Imagine it's a very beautiful concept and just learn it. Is rheumatic fever is common in savan or pancake? Sir, equally, it is common in equal. But pancake will have more of the mitral valve disease. Pancake more, she will have the mitral valve disease, and chorea also is common in pancake. Pancake will have chorea. Okay, nice. Next. So what all did we cover? We covered that rheumatic fever, basically it is a disorder which is caused by group A beta hemolytic streptococci, and basically main pathology is the antigenic mimicry. So the highlighter is GABA, group A beta hemolytic streptococci. The highlighter is it is a immunological disorder. Then highlighter is antigenic mimicry. Then 5 to 15 common, and 3 and 30 rare. Less than 3, more than 30. These are very beautiful way of putting notes. The pointers which I'm telling you guys are very important. Please write them these in your notes. अगर रोमैटिक फीवर की पूरी क्लास पढ़ ली और ये नोट्स बना लिए तो पीएचडी हो जाएगी रोमैटिक फीवर में. It's a medicine topic, it's a pediatric topic, it's a MCQ topic, it's a MBBS topic, it's any topic. Next, it's common in both, but pancake will have more of mitral valve problems and chorea. Yes, chorea में जो नाचने वाला निशान बनाया है बहुत अच्छा बनाया है. Chorioethetoid movement like a milk-made grip. That will do it in the further slides. And remember, aortic involvement is more common in boys. So pancake will have a mitral valve involvement, whereas the aortic component is usually common in savan. Okay, इतना हमको मोटा मोटा याद रखना है, ठीक है. पैनकेक से सर टीच ऑफ्थेल्मोलॉजी. मुझे नहीं आती ऑफ्थेल्मोलॉजी, मुझे पीडियाट्रिक्स आती है. अगर आती होती तो पक्का पढ़ा देता. Okay, yes, a very good question. How does the patient presents of a case of acute rheumatic fever? Very importantly, as I told, cough and cold. Please guys, put your best of the best positive energy in this class so that we all get very beautifully benefited and we learn this topic in a very healthy way. We don't have to cram or stress or remember. It just goes like this only. कहते हैं ना, बड़ी बात को छोटा करो, छोटी बात को कॉटन की तरह बनाओ और फूक मार के उड़ा दो. तो इतने लाइट होके टॉपिक्स को पढ़ो. The clinical features of acute rheumatic fever: the patient will have pharyngitis with fever 10 days to few weeks later by the reoccurrence of fever and manifestations. Nothing but like fever and pharyngitis is what we need to understand. 10 days to few weeks. Yeah, exactly. Pharyngitis with fever, 10 days to few weeks, and later again with the recurrence of fever. Criteria. So yes, yeah, everyone knows about it. We have something known as revised Jones criteria. Very important. Revised Jones criteria. Okay, where do you see Hall's criteria? I'll give you my mobile number. I can't say all that, but okay, I'll give you my chocolate. Okay, wait. I will give you eclairs. Where do you see Hall's criteria? अच्छा, ओहो, तो pancake ने सच बता दिया. Pancake, this is your toffee. Can you see this toffee, pancake? This is your toffee. And ये टॉफी, ये टॉफी का क्या हुआ? मैंने खा ली. Very nice. Thank you, pancake. Thank you. Hmm. Very true. Hmm. Chocolate. Okay. Hmm. So, तो खा ली. Sorry. Very yummy. Hmm. Hmm. Hall's criteria is seen in Down syndrome, and revised John's criteria is seen in acute rheumatic fever. We all know that we have major criteria and minor criteria, right? Major criteria. Yes, revised John criteria. Okay. So we have a low risk population and a moderate to high risk population. This is the updated one, guys. This is the updated one. In the revised Jones criteria, we have major and minor. In that one, we have low risk population and moderate to high risk population. Low risk population means when the incidence of rheumatic fever is less than 2 by 1 lakh, 2.5 lakhs in school going children. Yes. When the, what do you call, yeah, in the low risk population, the incidence is less than 2.5 lakhs in school going children, and rheumatic heart disease prevalence less than 1 is to 1000. This is the low risk population. Please, my dear friends, this is an exam question. Please remember, please, 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 please. ये याद नहीं होगा लेकिन याद करना है. We have a low risk population and moderate to high risk population. So low risk population means when the incidence is less than 2.5 lakhs in school age children, and rheumatic heart disease prevalence in less than 1 is to 1000. That is known as low risk population. Then in the revised down criteria, we have major criteria and minor criteria. Yes. Who will tell me? I will not tell you. 2 more minutes, then this class is over. अच्छा, once मैं जरा comments पढ़ लूँ. Hmm. Okay. Okay. Pancake says I want it. Okay. Raghuvan says हम सबने खा ली. बहुत अच्छी बात है. Hmm. दीपक आ गया. Okay. Hey Deepak, what's up, bro? Hmm. Pancake says I want Ferro Rocher. Ferro Rocher. Also, Ishita Srivastav, one of our dear juniors, our student Ishita Srivastav. That's her favorite chocolate, Ferro Rocher. I don't know where she is now. In the beginning, she used to attend all the classes, but now I think she has got a little busy. So yes, right. Hanji. Major criteria. Have you heard of pancarditis? So the major criteria are, very importantly, pancarditis, polyarthritis, erythema marginatum, subcutaneous nodules, and Sydenham's chorea. Very, very, very important. It's a very easy topic. Very, very, very easy topic. And let's just finish it. Let's just finish it, bro. We have major criteria and minor criteria. Major criteria is carditis. Like before, you used to say pancarditis, but now it is carditis. Carditis, polyarthritis, erythema marginatum, subcutaneous nodules, and Sydenham's chorea. I have each image, like each pointer has an image in the further slides. It will be very interesting for you guys. Please watch this video. So, PG entrance question number 1. Which are the early manifestations are the ones, and which are the late manifestations? Remember, carditis, arthritis, and erythema marginatum are the early manifestation. Okay. So yes, chartered accountant, CA are the early manifestation. Carditis, A for arthritis, E for erythema marginatum are the early manifestation. That's another exam question. Okay. Very good, very good. Mind blowing, pancake, mind good. And these two are the subcutaneous, are the cute late manifestation. समझ में आ रहा है? Is everyone understanding? Yes or yes? समझ में आया या नहीं आया? बहुत समझ में आ गया या कुछ भी समझ में नहीं आया? यार थोड़ा थोड़ा प्यारा प्यारा समझ में आया। एक तो शेव कब कराऊंगा मैं ये सोच रहा हूँ। प्लीज पैनकेक लेट्स डू शेव करा लेते हैं। आई थिंक दैट्स बेटर ब्रो। आई कांट रियली। ओके ओके ओके, मैं आ गया, ठीक है। शेव करवा लूँ ना मैं? हाँ, एवरीवन इज सेइंग यस यस। थैंक यू। देन दैट मीन्स यू वांट मी टू। थैंक you so much, so kind of you. Okay, staphylococcus beer. Okay, we can have it. Okay, then what are the, yes, very important, remember dear, in the revised zone criteria we have what you call major criteria. In the major criteria we have done very importantly. So it is divided into low risk and moderate to high risk population. Let's just finish the low risk ones. We have carditis, polyarthritis, very importantly, then erythema marginatum and Sydenham's chorea. Please remember, guys, this is a very, very, very important slide. Okay, so we have the low risk and the moderate to high risk. What is low risk population? Like major criteria is divided into low risk and high risk. What is low risk population? Low risk we just now read, when the incidence is less than 2.5 lakhs in school going children and the rheumatic heart disease prevalence is less than 1 is to 1000. This is known as low risk population. Is low risk population में what will be the what you called yes, what you called what is the major criteria? So the answer is very importantly we have carditis, polyarthritis, erythema marginatum and Sydenham's chorea or just chorea. So that the difference between the major criteria of low risk and moderate to high risk are same thing dear. Carditis is same, whereas arthritis, only polyarthritis is there in the major, in the low risk, whereas in moderate to high risk population it could be polyarthritis, could be monoarthritis, or could be just arthralgia. Anyone, what is arthritis and what is arthralgia? Who will tell me what is arthritis and what is arthralgia? Yes, exactly. Very good. Exactly. Yes, pancake is right. Arthritis is inflammation of the joint, right? And arthralgia is just the pain. Okay, that one is the pain, one is the inflammation. That's it. Chorea is same and erythema marginatum is same. So मोटा मोटा अगर हम सोचने वाली बात करें, it is like same only. Major criteria is same only. Just remember that in the low risk we have polyarthritis and in moderate to high risk we have the arthritis or even arthralgia also. Hanji, very true, Dr. Savan Singh. Arthralgia is only pain, while others arthritis is nothing but inflammation, signs of inflammation, pain, redness, local rise of temperature, local rise of temperature and all those things, right? Very good. Then and subcutaneous nodules and Sydenham's chorea. So all are same. Can you understand this slide? Hey Vanilla, what's up? बड़ी जल्दी आए हो, 1 घंटा हो गया, अब आ रहे हो. Okay. Then comes the minor criteria. What is the minor criteria? First of all, I want you to think little. What happens in minor criteria? Any recent history of fever or cough and throat? What happens? ESR, CRP. What is the minor criteria? The minor criteria number one. Again, it is divided into low risk and high risk. Polyarthralgia, fever of more than 38.5 degrees Celsius, ESR, and prolonged PR interval. Okay, these are very importantly, yes, 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 very true. Tuberculosis, अच्छा हाँ, signs of inflammation बताएं और सामान्य मस्त, क्या बात है यार, बहुत बढ़िया सावन, impress. So yes, minor criteria we have very importantly polyarthralgia, fever of more than 38.5 degrees Celsius, high ESR, high CRP, and prolonged PR interval. Prolonged PR interval. Okay, and in the high risk population, same. Instead of polyarthralgia, we have monoarthralgia. Fever here it was more than 38.5 degrees Celsius. Here it is more than 38 degrees Celsius. ESR was more than equal to 60 here. Here it is more than equal to 30. CRP is same, more than 3 and more than 3, and prolonged PR interval. Prolonged PR interval, unless carditis is a major criteria, then only you will say prolonged PR interval will be counted as a minor criteria. These are the very, very, very important points of the minor criteria. Done. Let's revise. What are we studying? Today's topic of choice was cardiology, and the subtopic was our rheumatic fever. Number one, you have to stay focused in life. Number two, rheumatic fever is caused by GABA. It is an immunological disorder. Basically, the pathology is antigenic mimicry. Most important, 5 to 15 age is important, and less than 3, more than 30 is very, very rare. Also, at the same time, remember it is Savan and Pancake both will be equally affected, but Pancake will have a mitral valve disease and chorea, whereas Savan will have, most importantly, aortic involvements, right? Also, the features most importantly are the basic pharyngitis. Like the patient will come with cough and cold and fever, right? Basic. But it is divided into major and minor criteria, which is known as revised Jones criteria. Also, at the same time, we revise something known as Hall's criteria, which is seen in Down syndrome. Down trisomy 21, Down syndrome, we see Hall's criteria. Major criteria and minor criteria. In major, we have low risk and high risk. The definition of low risk is nothing but incidence is less than 2.5 lakh in school going, and rheumatic fever heart disease prevalence is less than 1 is to 1000. Then also we saw that the in the major criteria nothing but carditis, polyarthritis, erythema marginatum, subcutaneous nodules, and Sydenham's chorea or just chorea. The CAE, carditis, arthritis, and erythema marginatum are the early manifestations, rest are late manifestations. And also we saw a very important point of low risk and moderate to high risk. Later you guys can make a note of it. This is very important. Like they can ask you like tongue twisting question here, and this part is of the major criteria is important, and also in the minor criteria also this part is important, that there it is polyarthralgia, here it is monoarthralgia, fever more than 38.5, here it is fever more than 38, like that the differences. Okay, done. It's 6:17 p.m. I have to go for running and gym at 6:45. So this much only we will study till now. See you at 8:30 p.m. And before going, we have this amazing quote saying that someone else is happy with less than what you have. So someone else is really happy with less than what you have. So moral of the story is we must be happy with whatever we have. Thank you so much everyone for the participation. Yes, I have to go to gym. We have an open gym nearby our house and I'm going there. First of all, I'll take a walk of 2 kilometers, like full running, then jumping jacks, then we have sit-ups, then we have chin-ups, then little push-ups, and then we'll start off with the exercise. Yesterday I did shoulder, today I'll do biceps, and tomorrow we'll be back. And but tomorrow I have night duty. So today evening, guys, 8:30 p.m. See you. Thank you so much everyone for the participation. Pancake everyone. See you after 2 hours, 8:30 p.m.